This individual has seen me for coccyx pain, and with the x-ray you can actually see that her coccyx is hyperflexed, and that's found in the x-ray report as well. She also presented with a subtle posterior sacrum, but it was an unusual presentation in that she actually had rotational mobility. Now, what she lacked was PA spring right at the mid-sacrum. That was blocked. She had a little bit of superior glide. She had reduced inferior glide, and when she was supine, the rotation of the ilium, it had some mobility, but it was less than normal. And I can only describe in vague terms that it just didn't feel right and didn't look right. It didn't look like normative rotation either. You'll also find greater tightness in the sacrotuberous ligaments and sacrospinous ligaments with this presentation. And because her coccyx was hyperflexed and sacrum is posterior, it makes perfect sense that a posterior sacrum would cause greater tone in the pubococcygeal portion of the pelvic floor. So restoring anterior glide of the sacrum makes perfect sense. And of course we've covered that already in our lesson. We've covered the topic of posterior glide of the sacrum, so I won't belabor that now. But this is a unique example in that she presented with posterior glide of the sacrum, but she had preserved some superior and inferior glide mobility and rotational mobility of the pelvis, although that was less than normal and seemed to be somewhat aberrant. Whereas in a typical presentation of a posterior glide of the sacrum, it wedges such that motion is lost in all directions. So very unique case presentation, and I appreciate the opportunity to film that. Thank you.